But I'd like to formally welcome everybody here today. We're having a discussion on Charles Bonnet syndrome. This is sponsored by the Vermont Association for the Blind and Visually Impaired. We're also welcoming the vision rehabilitation therapists from Division 11 of AER who are attending today as well. So we're glad to have everybody here. And a special welcome to all the clients of the Vermont Association for the Blind and Visually Impaired who are joining us this evening to join in this discussion. I'd like to introduce, we have Dr. Jeffrey Young is our main presenter this evening. And we have Lois Green and Kathy Boynton as our panelists that will be asking them some questions after Dr. Young presents his information here at the beginning. And I'm gonna read a brief biography here, a biographical sketch for Dr. Young. Dr. Young is an ophthalmologist with the University of Vermont. He's based out of the Berlin Eye Center here in Vermont. Dr. Young graduated from medical school at the Medical College of Wisconsin and completed his residency in ophthalmology at the Mayo Clinic in Rochester, Minnesota. Dr. Young's areas of experience or expertise include cataract surgery, glaucoma management, and dry eye management. Special procedures that he's particularly well known for include the removal of skin lesions, sutureless cataract surgery, and punctal plug insertion. Dr. Young feels strongly that he needs to have an open communication with his clients so that he's able to share the information they need so that all of his clients can make wise and educated decisions about their own eye health and care. So Dr. Young, we're very grateful to have you with us today, and we'll turn the time over for you to talk about Charles Bonnet syndrome.
Okay, thanks, Dan. It's a pleasure to be here, and I hope that what I share today will be helpful to some people. I like to try and make things kind of interesting and share some of the personal things behind the things that I'm talking about. So I figured I'd start a little bit with some of the history of Charles Bonnet syndrome and the man Charles Bonnet, and then talk about the actual syndrome, and then talk about some experiences that some of my patients have had over the years. And hopefully that will serve as a good springboard for the rest of the discussion. So the name Charles Bonnet syndrome was actually fairly recent. It wasn't until in the late 1960s that a couple of French physicians decided to name this as Charles Bonnet syndrome. But it was Charles Bonnet who described this syndrome back in 1760. So he was a naturalist and had used his intellectual gifts at observing the natural world. He was particularly good at botany, but he turned to his own family to observe his grandfather. So I guess I should also mention that Charles Bonnet, from a young age, had a hearing impairment. And often needed help due to his hearing loss. And later in life, he even developed some vision loss himself. But back to his grandfather, who was quite elderly, had developed vision loss initially because of cataracts, and then due to the, was later had cataract surgery, but back in 1760, cataract surgery was not what it is today, and that failed over time. And so his grandfather developed these hallucinations, and Charles Bonnet, knowing that his grandfather was of sound mind and didn't have any other mental incapacities, decided that these things were somehow related to the visual pathways that he had lost. And so he had described this syndrome in 1760, and people had known about it, but it wasn't really well understood until 200 years later in the 1960s. So another name for Charles Bonnet syndrome would be visual release hallucinations. And that name kind of gives us a little bit of insight as to what is going on here. The syndrome typically is something where a person with visual impairment, and it generally has to be both eyes that are involved, and the vision in most cases in the good eye is worse than 20/60, which is would be moderate visual impairment. So generally people have bilateral visual impairment that is that can be sudden, but it can also be associated with conditions that gradually worsen, like, for example, glaucoma, which might gradually get worse, and over time, once the vision reaches a certain point, these hallucinations might happen. So the hallucinations associated with Charles Bonnet syndrome are quite varied. Some people who have this syndrome describe seeing things that are what they call simple hallucinations, which are a simple pattern of shapes or a grid pattern, or sometimes lights, and it may be something that is overlaid over what vision they do have. Often these hallucinations have colors to them, and so these are something that are tend to be colorful. They may or may not be static, where they either stay in the same place and have no movement to them, and sometimes they can have movement. So that's simple hallucinations, which is one category of hallucinations associated with this syndrome. The second category is complex hallucinations. These tend to be things that are many people describe as being scenes or pictures that they see that are that may or may not be familiar to the person as something they've seen before, but may be a face, a person, a building, or an automobile. The image may have a lot of people, interestingly enough, describe people who are dressed in maybe older style dress that they wouldn't expect someone nowadays to be wearing. And they may have movement to them. It may be like a short movie that's playing where someone sees something moving, like a person walking upstairs, or somebody walking by. So those are the complex hallucinations that are associated with this. These hallucinations can last sometimes only seconds, or they can last for an extended period of time to where they seem like they're continuous. Fortunately, most people don't experience these as continuous, but they can certainly be that way in some cases. And most people, only about 30% of people experience the complex hallucinations, where they see a scene or something more complex than a pattern. So the interesting thing about these type of hallucinations is that they are only visual in nature. So when we talk about hallucinations in general, there are hallucinations associated with a mental illness, are generally something that may have a visual component to it, but generally is an auditory component, where they're hearing something is being said to them or about them, and often people will hear something. Other kinds of hallucinations associated with brain conditions might give a smell sensation. Certain forms of epilepsy people might have a hallucination where they'll smell something in particular. But these hallucinations tend to be ones that are only visual in nature, but often are in color and may have movement. So it's interesting that we don't have a good sense as to how many people might have this syndrome, because there is we expect that there's probably a lot of people who don't report that they have this because they might fear that their family members or providers might think that they have a mental problem that might require them to be put in an institution or something like that. And so many people, though they are experiencing these type of hallucinations, do not report them for fear that they might be misinterpreted as having some form of mental illness that would be more serious. So the estimates that we have are that this can affect up to 50% or more of people with severe vision loss. So this is fairly common. We think it's fairly common, but like I said, the numbers are pretty difficult to pin down. There's often the cases that I've become acquainted with, in many cases, I'll have a patient, for example, I've had several patients where they'll, maybe they're a person who has macular degeneration and they've been slowly losing their vision, and they've gotten to a point where they are no longer able to be independent, and they will show up to an appointment with me with a family member. And the family member will often prompt the patient and say, well, why don't you tell them about those things you've been seeing in your vision? And I've had that happen on many occasions where the family member is concerned about these things that their parent or family member's been seeing in their vision and wants to know whether it's something more serious. And the good news is that it generally, Charles Bonnet syndrome is something that's not serious. It's not indicative of a bigger problem. It's also not generally indicative that the person has a higher risk for having dementia or some other form of mental decline. So often when I see a patient like that, where the family member is concerned about them, I can reassure them that this is something that is not necessarily indicative of having a condition of mental deterioration. So a lot of people are interested in knowing whether there is a treatment for Charles Bonnet syndrome. There have been a lot of treatments that have been tried, and some of them have reported varying levels of success. The ones that most people are able to try that don't require starting medications are ways to try and redirect their vision or their attention. And so one thing that some people have tried would be to blink rapidly if they're having this type of hallucination. Blinking rapidly might change your attention and change the light getting into your eye and be able to reset things. So that's one thing that's been tried. I have to say that patients that I have who have tried this have varying levels of success with it. So something that can be tried, but may not totally fix the situation. Another one is to move the eyes rapidly back and forth. That may help in the same way by redirecting the attention, but the hallucinations may persist even in those situations. One thing that is pretty well accepted as being able to help with this is in patients who are socially isolated, who don't live with someone or who maybe are spending large amounts of time alone, it can be helpful for them to increase their social engagement. That's been shown to have an improvement in the hallucinations. Now, in some cases, people are bothered by the hallucinations that they see. In my experience, I've had a few patients who have had kind of intrusive hallucinations. I had one patient several years ago who was talking about how she was sitting at home and where she lived alone, and she what appeared to be people walking across the yard and coming toward her house. And she viewed this as people, who were coming and trying to break into her house. And she had seen this same thing several times. And even though she had known that this was not likely, there were times where it was in deep snow and she could see these people walking through without any difficulty through this deep snow. And she knew that it was not something that she was actually seeing. She was still felt very alarmed by this. And this really bothered her. Now, in these cases, sometimes people may, if they're significantly bothered by this, they may request some kind of treatment for it that would be a medication or other kinds of treatment. There's been a lot of medications that have been tried, and many of them are only marginally successful. And so generally, even with intrusive hallucinations, people are not given medications because in medicine, often when we see that there's a bunch of different medications that are suggested for a condition, that generally means that there's not one of those that's very good at treating it at all. And so most cases of this are treated with just having patients try other techniques. Some people are even helped by having talk therapy, where they can talk through what they're going through. And so psychological therapy may help, even though there's may not be an underlying mental condition that might be considered in these cases. Let me see. So one thing that I would mention is that this can be, the conditions that can lead to this are essentially anything that can cause someone to lose vision. So disorders that affect the retina are probably the most common and commonly related to this. So macular degeneration and forms of disease that affect the retina of the eye tend to be the things that that bring this on the most. At least in some studies, they've shown that about 57% of people with severe macular disease may have Charles Bonnet syndrome. But I have seen this and had patients who have had different forms of vision loss, from glaucoma to non-arteritic ischemic optic neuropathy. Some forms of blood vessel blockages may cause this. Even people who have had a stroke, which doesn't actually affect the eyes themselves, but affects the visual part of the brain, may end up with this. One way that I like to describe it to my patients is that what may be happening, and this is, although it's not totally understood, but some studies suggest that when you have deprivation, or when you have decrease in input from one eye, and typically both eyes, the brain, sensing this deprivation or this lack of input, will activate another area of the visual cortex, which may contain parts of the vision that are particularly good at sensing different things, like faces, for example. And that part of the brain of the visual cortex might be activated, and the person would see a face in their vision as their hallucination with Charles Bonnet syndrome. So it's something where the brain is almost taking something from the memory banks and putting it in place where there's no input from the eyes or from the visual system. And so some patients may experience something that they've seen before, where they may see a person that they've seen before, but a lot of people will see something that maybe is just a generic person. I had one patient once who described this to me, where she said that she saw a person when she looked out of her window at her yard. She saw a person mowing a lawn, like pushing a lawnmower, walking back and forth. And there were times when she knew that this and the way that she knew that this wasn't true or wasn't something that was actually happening is because it was the middle of winter and she saw what looked like a person walking back and forth mowing a lawn when she knew that there was significant amount of snow on the ground. And so that's how she came to me and said, I know that this isn't happening, but I'm seeing this and it's happened several times, and I just want to know what's going on. And fortunately, I was able to reassure her that this is something that is more a result of her vision loss and is not a result of cognitive decline, because she was certainly concerned about that, and that was her biggest fear, that she was going to be placed in an institution by her family. And so fortunately, we were able to talk through that. So I've shared most of the stuff that I had wanted to share. I would maybe ask Dan Norris if there's other things that I should share. Otherwise, we could turn time over to the panelists and have a chance for their stories.
Thank you, Dr. Young. That's good information. And for those who are on the call, Dr. Young's going to stay with us to answer questions and answers after we meet with the panelists. So I think that was great. Thank you, Jeff. So we're going to turn to our panelists now, and I'd like to introduce Lois Green. Lois Green lives in Norwich. She's retired, but she used to work in medical offices, including an ophthalmologist office. She was diagnosed with macular degeneration in 1994. And in 2021, she was diagnosed with Charles Bonnet syndrome. Since July, Lois has been serving as an ambassador with our agency, the Vermont Association for the Blind and Visually Impaired. She's been providing direct peer-to-peer support with other clients on the phone. And so we're really grateful to have her with us this evening. And then I'll also introduce Kathy Boynton. She lives in Rutland so that she can be close to her 2 children and grandchildren. As a child, Kathy was accommodating for an unknown visual impairment that wasn't diagnosed until she was out of high school, and it turned out that she had Stargardt's, which is a juvenile form of macular degeneration. Also, that's what I have as well. Kathy is on the record saying that she's not going to let anything stop her, and she has been actively pursuing training and orientation mobility so that she's able to travel around Rutland independently. So we're grateful to have you with us today as well, Kathy. So Lois and Kathy, if both of you can come off mute, I'm going to ask you both a question. We'll start with Lois. Lois, if you could share with us where you first learned about Charles Bonnet syndrome.
Well, yes. Hello, everyone. Just the little history. I was diagnosed in 1994 with rapid onset age-related macular degeneration in both eyes. The right eye quickly went, the central vision. The left eye was stabilized. I never heard about hallucinations until 1999, when I was told by the retina physician I was seeing at that time to be prepared. I could have hallucinations. No more was said, and to me, being very misinformed, I thought that hallucinations were these frightening medical issue things. And it finally, I realized, because even I had been seeing, example, I can't see straight lines. I would see a telephone pole and I would only see the top of it. And underneath might be standing a man or a large trash can. And, I knew that the telephone pole went all the way to the ground. So I knew this was a visual brain thing and didn't think anything about it, was not frightened, and went on that way, like there might be a bush beside the road, but my brain would tell me it was a motorcycle. But when I got there, it was definitely a bush. And it was all livable, nothing frightening. And then in January of 2021, I had a startling 21-hour experience of constant hallucinations, all not real characters, some frightening things, some cartoons, some lovely, beautiful blooms, one at a time, a lot of grids on the ceiling and walls. Now, I knew this was erroneous because I can't see straight lines, so I certainly can't see these 4-inch tiles all over the place. And I could not see the ceiling light, the ceiling fan, the frame photos on the wall, my furniture. This was all, I was just seeing these other things. So this was on a Sunday. Monday, I called the low vision doctor's office, and the assistant introduced me at that point to the word Charles Bonnet syndrome. I was seen the next day, all kinds of talking and tests and stuff, and was told I had complex Charles Bonnet, as was what had been happening. So that was my introduction after so from 1994 to 2021, I did not know that this could happen. No one had mentioned anything like this, and I had been seeing ophthalmologists, retina, low vision for years, and it was a little startling. I will say this, I had 2 more so-called complex situations, one later that year for 4 hours, another the following year for about 4 hours. Ever since I had the first episode, almost daily, I have the simple Charles Bonnet to this day. And actually, I'm starting to talk to them. I like, oh, you're here again, or it's time for you to take a hike, stuff. I've never been frightened because I never had anything as a whole figure. It's always been like a bust, like from below the neck to upwards, even the frightening ones. The colors have been beautiful, except on the frightening ones, they were always black and white. And there was never a sound, never a smell, and lots of time, except for moving beautiful vines and bushes under like water, that kind of movement was the only real movement I saw. Nothing charging at me, just the awful saliva and open mouths and that sort of stuff. So I've never been frightened of them, and do understand why it's happening. And I have told many other people about it, and I'm not quiet about it. Anyway, that's how I learned. I feel I should have been told sooner and been more prepared.
Thank you, Lois. Kathy, your experience.
Where to start? Hi, everyone. I do have the Stargardts, and it's the rarity form, which I think Dan has a different form of it. I ended up going totally blind. And 4 years ago, I actually thought I was hallucinating until I got in touch with, I'm on a support group on Facebook, which is Stargardt support group. And I kind of explained it out there and asked if anybody knew what was going on, because I hadn't seen a doctor in for years, since 1974, as a matter of fact, because once they told me what I had, I didn't think I would need to. All right. So somebody had posted, check out the article, what they have out there on Charles Bonnet syndrome or Bonnet syndrome. And I did. And it's like, oh, good. I'm not hallucinating. I experienced, well, till this day, right now, I am in a cycle with my sight. I don't have any vision whatsoever. I did go totally blind 4 years ago. And one day I'll wake up and everything will be white. And then 24 hours later, I'll wake up and everything will be black. And it's a cycle. So the days that I was seeing these hallucinations, which are children, and that's the only, maybe once in a while I'll see some or like lattices or just different designs, and it all starts on the right hand side and it stays on the right hand side of my eye vision. And these children would just come through, stop, turn around, float back into where they started from. And they had the most prettiest colored clothes, colors that I never experienced when I could see. And like the days that are that I see white, they are in pastel colors. They got blonde hair, both girls and little boys. When I am seeing black, they are they have black eyes. As a matter of fact, I don't think I can see the ones, the light colored pastel ones with what color eyes they have, but with the darkness that I see, they have black eyes, they're tan color skin, brown hair, and they're mainly boys. So, but I have not, since I've moved here to Rutland, I was in Pennsylvania then. Since I moved back to Vermont, when I was living by myself in West Rutland, I saw these visions a lot. At nighttime, it would be disrupting for my sleep. Now that I'm where I'm living now, I've been socializing, and believe it or not, I don't see these images as much as I did before. So it was quite the experience. And when I tell people what I'm seeing, they would say, I thought you were blind. And I says, hey, I still see things. And I have to explain. And it was hard for me to explain because I didn't really know a whole lot about this syndrome.
Nice. Thank you. So, both of you kind of shared a few experiences that you had with it. Are there other experiences, Lois, that you had with Charles Bonnet that you'd like to share with the group?
Well, the only thing I hadn't mentioned is with the ongoing ones are that at the end of the day at night, I have the black and white, well, I'll call scary, but I'm not scared, but the attacking wolf thing or something. And I have the beautiful flowers or the swaying bushes or very other things with the most gorgeous colors will come early in the morning, or if I run out of energy in the afternoon, I'll have them then for a short while. They're very brief. So it's interesting the time of day, the difference.
It affects the kinds of things that you're seeing. Interesting.
Yeah.
Kathy, are there other experiences that you'd like to share with the group? It's okay if you're not.
Yeah, I can't think of anything really, except for the flickering of, it's almost like I see flickering all the time, and when everything is white, which I know that doesn't have anything to do with the syndrome. It's very, I'm afraid that I'm going to walk into things all the time, but when it's dark, I feel more relaxed. But yeah, so the beautiful colors and the children, I try to stop them and say, stop, I want to see your face, I want to see if I know you. And some of the images, I think I know who these children are, but then on the other hand, I don't know. So it's like they don't come out as often as they did.
Interesting. As both of you are sharing, I'm hearing details that Dr. Young had shared throughout his presentation, which is really interesting. What are some of the strategies, Lois, that you use when you want to get rid of do you have any strategies that you've found useful?
Very definitely. Absolutely nothing helped with the complex ones, nothing whatsoever. But with these simple, I'll call them ones, I turn on, if the lights aren't already on or the sun isn't fully shining in the house, I'll turn on all the lights I can that are in that particular room. I will close my eyes, turn my head quickly to one side, open my eyes quickly, shut them, turn them to another position quickly. And I do find that these are very brief, these little tricks stop it.
Wow.
And they don't recur right away unless later in the day or at the end of the day. Yeah.
Kathy?
I've tried, I've actually tried some of the exercises like the blinking constantly, continuously, or the left to right, bringing my eyes to the left to the right really fast. And the only thing I've found that it would make it disappear is when I fell asleep. So when I slept, I didn't see anything. Thank goodness.
There you go. When all else fails, go to sleep.
Yes, go to sleep.
All right.
Dan, I
Uh-huh.
wanted to say that someone on telephone number 1909 has their hand up.
Oh, okay. Well, we're going to do Q&A in just a few moments.
Oh,
So,
okay, sure.
so, all right. So 1909, hold that thought. We'll be right with you. Well, so Lois and Kathy, we've been going Lois first and Kathy, so we'll do Kathy then Lois. How's that? Is there anything else, Kathy, that you'd like to share with the rest of the group that you think is important or that you'd like people to know?
Well, actually, I really don't know too much to say about this Bonnet syndrome, but if it wasn't for the Stargardt's group on Facebook, I would never have known what it was.
So being connected with other people helps, and
Yes. Yeah.
and peer support's a good thing.
Yes, it is. Definitely.
Excellent. Thank you. Lois?
I just want to stress that at least in my journey through this, they are absolutely silent. So it tells me it's not real, and so there's no fear, never been a fear of it. And I don't feel that it's been illusions, putting it under my characterization of illusion. It's very real what I'm not seeing. I have no idea if this is true or not, because no one in the profession has agreed with me or disagreed, but I am completely right side dominant. My right eye is incredibly dominant, even after all these years, since 1994, when it went, central vision went very quickly right then. It will not give over dominance to the left eye. So everything that happens first is actually from the unseeing eye. The left eye is losing ground rapidly. There's a lot gone, but it's not the first to take over, take control. And my question has always been, is this got part of why I'm getting the constant little Charles Bonnet hallucinations? It can't help, doesn't bother me. I just would like to have an answer, because it seems to be unique.
Interesting.
Yeah. So no, I have nothing further to say, except if you can't hear it, don't run from it.
Can't hear it, don't run from it. Okay, that's good advice.
Like that.
Well, thank you both for sharing your experiences, and thank you both for staying here as well as we get ready to open up for questions and answers. Before we open for questions and answers, Dr. Young, is there anything that came to your mind while you were listening to the panelists that you'd like to comment on or share? And maybe, I don't know if Lois's question has an answer to it.
Yeah, Lois's question is a little bit difficult. You know, the thing about Charles Bonnet is it's kind of difficult to study, because, you know, documenting what is actually going on is very difficult. The biggest studies that have shown this are what are called functional MRI studies, where they've been able to show that a patient, when they're experiencing these symptoms, they're having activation in their visual cortex. And so that's probably one of the only ways we know about this, but mapping it down further to particular parts of that is a little bit more difficult. And so, you know, the dominance of eyes and is yeah, a little bit difficult to sort of sort out whether that, you know, that's something that's related to the Charles Bonnet. It probably is, but I think the answer would be a little bit hard to confirm.
Could I just say, please, that the right eye is open. It's always open during any of these. The left eye opens in slow motion. It's almost like I have to tell it to open. So there is, yeah, it's just an interesting thing that I'm aware of. I mean, always open during the hallucinations. It's not always open when I sleep, but yeah.
Well, it's certainly the eye with the worst vision. Many patients say that the eye with the worst vision is where they see it. So if they have worse vision in, say, their right eye,
Yeah.
often will feel like the hallucinations are more toward their right or toward their left. Now, with both eyes being similar, we don't see that. It tends to be kind of full vision. Now, one thing I maybe didn't mention is that this is considered to be quite rare, or even I don't know if I would say impossible, but quite rare in people who have lifetime vision loss. So people who are maybe born with a condition that has them never develop any vision. In those cases, this we typically don't see something like this, Charles Bonnet. So it appears to be something that you have to have some sort of visual input. You know, the earliest cases are somewhere around 10 or 11 years old, where people have developed this, and so it can happen.
Are you always alone when
in
these
young
problems?
people
Do they
that,
ever happen when it's completely dark in the room?
I didn't hear that.
So that was the Jaws was somebody has Jaws and that was reading a question, I think.
Okay.
So we'll ask the question in a second. Did you finish your thought, Dr. Young?
Yeah, I think that was it. That just the people with lifetime blindness may not generally not considered to experience these Charles Bonnet hallucinations. Okay,
excellent. Thank you. So Melinda, have there been? It sounds like there's been some questions that have been posted to the comment. Would you mind reading those questions, and then we'll open up for people that have their hands raised to ask questions verbally.
Okay, so yeah, well, let's go to the telephone 1909 because they've had their hand up for quite a while.
Kathy, I guess if you could mute now, I think your Jaws
Okay.
is what we're hearing. So thank you, Kathy, and feel free to unmute if you need to answer a question. So go ahead. 1909, you have your question?
Yeah, am I muted or?
No, you're talking. Go ahead.
Okay, I didn't really have a question, but I had thought of something when one of the panelists were mentioning flickering light in some instances. And I was wondering if when you see light, would it always be flickering or could it be just constant? Because I noticed something the other night. I would be in the dark room at night, ready to go to bed, and even with my eyes closed, I see light, like the room is lit up. I don't see anything in particular, but it's like lights are on. I was wondering if that had something to do with Charles Bonnet syndrome.
Dr. Young?
So so you can have flickering lights, but usually with Charles Bonnet syndrome, there's less of the flickering lights and more of a if there's something moving, it's usually a complex hallucination. If it's something like the simple hallucination with patterns, they're generally not, I would say, flickering. I mean, certainly there are other things that can cause flickering in your vision that might be concerning, problems in the retina or problems in the brain that could cause flickering. So that's something that maybe should be looked into, but flickering itself is not generally considered a part of specific to Charles Bonnet, but it can, you can have sort of patterns that may, I don't know if in and out of focus, but they may be there and that may change. Certainly there are light, just generalized light things that can be considered associated with Charles Bonnet, but I would say for the most part, people are noticing something that's a little bit more formed than just light on or off kind of phenomena.
Oh, okay, thanks.
Thank you, Dave, for the question. And Dr. Young, with my Stargardt's, when I close my eyes, I still see the scotoma because it kind of is a it kind of shimmers a bit. Is that maybe, Dave, what you were thinking about with the flickering with your scotoma?
Well, I didn't have the flickering. I just noticed that one or both of the panelists had mentioned that they experienced that, and I wondered if my constant light was part of Charles Bonnet syndrome. I mean, I know it usually forms or shakes, but this was just like lighted. My whole field of vision looked like it was lighted.
Okay.
It lit up.
Okay. And like Dr. Young said, definitely information you want to share with your ophthalmologist.
Okay.
Excellent. Thank you, Dave. Is there another question, Melinda?
Yeah, I did want to say that for some reason, I can't access the first 4 messages. So if you texted or wrote it in the chat early on, these showed up at about before 6:15. So you may need to re-enter that if it's still germane. So the first question is for Lois. Audrey's curious if something triggered the onset of Charles Bonnet syndrome in 2021. Were you stressed or some situation that changed in your life?
Actually, that's very real. I was grieving for the loss of my husband who died the month previously. I was having to deal with documents and all kinds of paperwork, and much of it with numbers, which I can't read numbers. And it was very stressful. The next 2 that happened, they were not in stress situations, but they might have been due to having had interrupted sleep patterns those 2 times.
Great question. Thank you, Audrey.
The next question comes from Lori, and she wrote, over the years, I've worked with several clients who have experienced Charles Bonnet syndrome. Most all of them have been totally blind. Today, I've learned it's in various types of vision loss. Lois, pardon me if I've missed this, but how much remaining vision do you have?
The central vision is completely gone in the right eye. The left eye, I have maybe a little over a third left.
Thank you, Lois. And thank you, Lori.
Okay, so this is from Judith. Why do you think people who have been socially isolated and then, oopsie, my thing jumped, hold on. Been socially isolated and then increase their socialization, decrease their hallucinations?
That's a great question. That one probably goes back to Dr. Young.
Yeah, so it's interesting. So the thought is that some of this comes up as a result of deprivation. So when you have a decrease in inputs into your brain, then in some cases this can cause you to have parts of the brain that start to, especially this visual cortex, starts to become activated. And so it's thought that this deprivation, they've tried to associate it with things like phantom limb syndrome, where if someone who's an amputee, they can still feel parts of their hand, or they might have pain in their hand, even though they might have had their arm amputated. And so they say it's something like this. And so if your brain is deprived of an input, and social inputs have some role in this, I think it's not entirely understood why particularly social isolation contributes to this, but the studies are pretty good that when people, especially who are in an isolating environment, like they might be in a nursing home situation where they don't have a lot of interaction except maybe to receive medications or something. In those cases, just giving them more interaction seems to resolve the symptoms. So I don't know if it's well understood, but the whole idea that the visual cortex becomes activated when it's deprived of input is the reason for this. And so they think that maybe these other inputs as well might stave off the onset of these hallucinations.
That's fascinating. Kathy, when you were sharing your experience, did I hear you say that you had you had had less when you became more socially connected?
As a matter of fact, yes. Ever since I've been here at the Maples Community Living for the seniors / disability housing, I have seen less of my visions, but they do still appear every so often.
Interesting. Dr. Young, was there an increase in Charles Bonnet syndrome when COVID-19 hit, out of curiosity, with the social isolation that people experienced?
I don't think that's been studied. That would be very interesting. And I would estimate that there has been, but there hasn't been any studies on that. In fact, there's very few studies recently on Charles Bonnet syndrome in general. And I think it's partly because it's difficult, to sort of find and document these, and because maybe a lot of people who are experiencing this are, scared to share it. So I think we would, even if we did a study about it, it would probably significantly underreport.
Interesting. All right. Thank you, Judith, for the question. Yeah.
So the next question comes from Pamela and John, and it's two questions for Lois and Kathy. The first is, are you always alone when these come? And the second question is, do they ever happen when it's completely dark in the room?
I can go. I have found, although I always like to sleep in a very dark room, I no longer do. I make sure there's always some kind of a light because of these. And not a bright light. If I need bright, I can turn on more. And the nighttime ones, yes, of course, I'm alone. During the day, many is the time I have not been alone. So that one's kind of up in the air. Morning ones, early morning ones, I'm alone. But midday, often I'm not alone. Or driving with someone in a car, I will see a lot of different things because of the vision loss. My brain's telling me all these things, and it's quite a joke because I'll tell them what I'm seeing and they're laughing about this. And so, yeah, those times I'm very social.
Interesting. Kathy?
Well, it's hard for me to say because I'm in the dark all the time. No pun intended, but I'm actually totally blind now. And I really don't know when they really occur. So that question is very hard for me to answer.
So at nighttime, typically the lights are completely out and you still have them?
I have them during the day, even when I have my blinds open. I always ask if somebody comes into my apartment, do you need the light on? Is it dark in here? So I really can't say. They just seem to appear when they want to appear.
And are you typically alone, or do you also have it happen when people are around?
Oh, good question. When people are around, I do not see these images. So yes, when I am alone.
Okay. Thank you, Pam and John, for that question.
Okay, the next is a comment from Susan. Over the years, As I've been employed as a CBRT, it seems that people are relieved when I share information on, quote, seeing unusual things, unquote. People seem to appreciate hearing the words, quote, visual disturbances, unquote, versus hallucinations. I've had people say they see cherries, paisley prints, and one woman had a stagecoach with horses that would travel left to right. So I don't know if someone wants to comment on that.
I think you should comment on that one, actually, Melinda. Melinda had a client that she shared information about Charles Bonnet syndrome with before she had it. Do you want to share that, Melinda? Just the experience there of how that helped the client?
I'm like, Dan, you have to remind me. I'm sorry.
Sheep farm.
I'm not
I'll
remembering this.
share Melinda's.
Yeah.
I'm
Thank
Melinda's
you.
supervisor, and she introduced me to a client one day. And this client had been diagnosed with macular degeneration, and Melinda was working with the client. And as just a matter of course, she asked about, do you ever see things that aren't there? And then explained to her what Charles Bonnet syndrome was. And the client was very interested, had never experienced it before, but then shortly after that, had been admitted to the hospital with a major medical incident that took place. And at that time, she wasn't able to speak, but she started experiencing Charles Bonnet syndrome while she was in the hospital. She would see people come into the room, run behind the curtain, stand in the shower, things like that, that she knew they couldn't possibly be real. But because Melinda had shared that with her, she thought, oh, this is that Charles Bonnet syndrome that Melinda was talking about. And so it just helped her to know, especially during a time where she couldn't speak and talk to people about what she was seeing. It gave her a great deal of comfort to know what was going on and that she wasn't losing her mind or anything. So that was so I agree with you, Susan, that it's important as teachers that we share with clients so that they're comforted, because like Dr. Young said, this very underreported because people are scared what people might think. So, just having an open discussion about it is a good idea. So thank you, Susan.
And Susan, I just wanted to mention, I appreciate that you said visual disturbances. When I'm talking with patients about this, I try and, I'm sure subconsciously or unintentionally say hallucinations. I know hallucinations tends to, and for most people, have a negative connotation. They think a hallucination is something that means that I'm crazy. Where if you say a visual disturbance, I agree. I think people would respond better to that, and I think that's something that I'll have to try and pay more attention to. I know that certainly people, when we tell them about this, they are comforted in knowing that it's not something that's associated with a problem that is going to affect them in the future. And so I think approaching it as saying this is a visual disturbance, this is a visual problem, not necessarily a mental problem, I think that would help people. So very interesting.
That's a great point. Thank you.
Okay, we've got a lot of messages coming in. I hope I'm saying your name right, BB. This is from BB. Have you heard of people being able to intentionally control a para-hallucination? For example, quote unquote, seeing a person mowing and making it go in a different direction or change the image. I had a client report this to me.
So I'll just mention this. So in the literature, it's generally thought that people cannot control these. Unlike some dreamlike hallucinations, people are sometimes able to control. Generally, it's thought that these hallucinations are not ones that are able to be interacted with necessarily. And so it usually is something that's passively happening, and people are not able to control that, like you might be able to feel like you have some control in like a dreamlike hallucination. Sometimes people can have these types of hallucinations when they're either going to or coming out of sleep, where they maybe have an interaction with this with a hallucination, where these ones are generally thought to not be able to be influenced by our interactions.
Thank you. Good question, Phoebe.
Yeah, these are all great questions. This is from Elizabeth. How well known is this syndrome in the medical community? I had a former client who had some medical issues and her doctors were not aware of this syndrome, so she had to explain it to them.
Yeah, I think this is a great question, and one that is so I think so as ophthalmologists, we know about this, but I think we don't, and I think it's, because we don't hear about it a lot. I know a lot of patients are a little bit hesitant to describe this or to report this. I think we maybe assume that it happens less often than it does. I appreciated Lois's description, how she wished she had known earlier. And I think it's something that, probably as ophthalmologists, we should maybe explain earlier, because ophthalmologists know about this. I think the people that maybe know the least about this are probably the ones who may encounter it the most. Our, primary care physicians are probably, I know that I have interacted with some primary care physicians in our area that ask me about this. And they say, I'm wondering about this. This is something that I think might be affecting my patient. And I've had some interactions with them. And I think that's something that, outside of maybe ophthalmologists and neurologists and probably psychiatrists, a lot of other physicians don't know much about this, and may go along the route of considering some form of other form of hallucination, where generally when I see a patient and I know that they have a certain level of vision or vision loss, this is something that immediately comes to mind. But I think the awareness is something that certainly could be improved. The comment that Judith made down there about this, saying that this is prevalent, as I said, but it occurs commonly, but a lot of people don't know about it, and there's not a lot of research done. I mean, that's something that certainly that's interesting, that is maybe a big something we're missing a lot of opportunities to inform patients, but also maybe to increase the science behind this.
Good question. Thank you.
Okay, this is, hold on just a sec, sorry. So it's jumping down. We're getting a lot of feedback here. So this is from Judith, and it's for Lois. Do you think closing your eyes for a few seconds and then opening them again, not blinking, would help the visions end?
That's what I do morning and at the end of the day with the other ones. Along the highway, when my brain is telling me I'm seeing something that's different than what's actually there, it's just, there is something there that triggers my brain to say something's there, although it's not the bottom of a telephone pole, for example, but it's a man or a garbage can. No amount of blinking or turning head or anything will do that. And when I actually get to that, wherever it is, and actually see it, it's just like a confirmation. The brain was just trying to fill in the blank hole that I can't see. So nothing helps in those real life instances.
Okay, great. This is a question from Julia. Is there any genetic component to Charles Bonnet syndrome within families?
Around the family.
So I can answer this one. So not that we know of, we mentioned that there's not a lot of research done on this syndrome. But the only way that there might be some is, there are genetic forms of vision loss that can affect multiple generations, and this may run in those families. But as far as having a separate genetic component, there's not, it doesn't appear that there is. The biggest risk factors are, certainly level of vision loss and age. So age is a significant risk factor, that this is much more common in people who are older. It just so happens that people who are older also have the highest burden of vision loss. And so, it's a little hard to sort all that out, but certainly the risk factors that are very much at the top of the list is age and level of vision loss.
Excellent, thank you.
Okay, and Judith just had a comment. It's interesting that 50% or more of persons with visual impairments have experienced Charles Bonnet, but very little research is done. And I have a question. Is it's actually 50% of people with retinal or macular disease, right?
Correct. Yeah, that study was looking at macular disease, and they found that a little over 50% of people had it. But like I said, with vision loss, it varies. Some people estimate that 10% of people with severe vision loss have this. Others say more than 30%. So there's a pretty wide range of expectation. But in macular vision loss, one study, which was kind of small, still suggested that it might be over 50%. Because that's, and it makes sense that that's the area of our vision that tends to provide the most information. And so when you take that away, there's a bigger hole to fill. I liked how Lois said that there's, that her brain is filling in the hole there. And so when you have that central vision loss, it tends to maybe your brain is really trying to fill that in a little bit more.
Okay, and that's it for questions and comments.
Questions, comments? Okay. Does anybody else have any questions or comments they'd like to ask or share with the group that's on the call? If you wanted to come off mute and share it, you may.
Julia, you want to come off mute? And
yeah, so there's this really good NPR clip that I like to use at my support groups about Charles Bonnet syndrome, and it has a comedic side to it. So just something to know about if you're a CVRT.
If you wanted to share that link with me, Julia, I could share it with everybody when we send out the recording to folks.
And there's also there's an interesting TED talk that was by Oliver Sacks, who's a pretty well-known neurologist, where he talks about this. He has a book that describes this. Well, it's quite a long book that's called Hallucinations, and it talks about this in some detail. And so he's a very good speaker, and he shares about Charles Bonnet in a TED talk that I could maybe send over to you, Dan, that you could share as well.
That'd be great. Thank you.
Dan, I have a question. This is Audrey Dannenberg. Kathy, if this is too personal, please don't answer it. But I was curious, from what I know about Stargardt's, is that it wouldn't lead to total blindness, and yet that's what you have. So do you have a secondary eye condition, if you don't mind answering?
Well, actually, I was told back in, oh gosh, in the late 1990s that I had the cousin of RP, which was taking away my peripheral. And then I took it as that. And then I just recently went to Dr. Maya up in Burlington, and he said that I don't have a secondary eye disease. I ended up with the rarity form of Stargardt's, which is very rare and uncommon. So anybody that has Stargardt's disease, if they don't have what I have, they will not lose their sight totally like I have.
Okay. Thank you for explaining that. That is always what I'd heard, and so I was kind of surprised, but thank you.
well, this is Melinda, and I have a question for Dr. Young. I just had a client who has 4 siblings with Stargardt's that didn't show up until they were adults. And he said there's something like 30 different kinds of Stargardt's. Can you clarify that? I had not heard this.
Yeah, so Stargardt's is, yeah, it's a little like, there's a lot of eye conditions like this where there's a certain look to it. So it's been described as the way that it looks. But then behind that, there's a lot of genetic variations that lead to that. And so just like yeah, Stargardt's there are multiple genetic variations that can lead to the end result of having Stargardt's disease. So those are the variations. A lot of them are just classified as Stargardt's disease, and many times they're not clarified further than that. The same is true of retinitis pigmentosa. There's a huge variety of that, and that maybe even has even more variations than Stargardt's disease. But it's just the end stage where it results in a particular look of the retina. And so probably there's, there are actually different conditions that we just classify as, say, Stargardt's disease, but it may be some very different ways that lead to that. But the end stage is that it'll have a certain look. And so it's classified as Stargardt's disease. That's how we diagnose it generally, because we, only in rare cases might we do a genetic test on a bunch of people to determine, like say family members of someone with Stargardt's disease. You might get a genetic test that might give you some ability to say whether someone might develop Stargardt's disease, but but there's always being new variants developed, and so a test like that may not catch all the variants.
Okay, and Dr. Young, someone's asking for the spelling of Stargardt's. Do you mind doing that?
Oh, somebody beat me to it.
Yeah, go ahead. Stargardts.
Yeah, it's a DTS on that one. I think it was a Danish ophthalmologist that named it, or that was named after.
Okay, so Dan, there is interest in the resources and the links. Are you able to send that to everyone who's on the call?
Yeah, what I'll do is I can take the TED Talk, and I can take the resource that Julia is going to send me, and other things, and I'll send out a email blast with the link to the YouTube channel that we load this to, along with those additional resources, and I can send it out through AER as well as the VA BVI email blast, and also the VRT listserv.
Okay, great. And Devin also asked for the best place to refer people looking for information on Charles Bonnet syndrome, and are there support groups available specifically for people who have this?
Dr. Young, on the referral aspect, or?
Oh, referral, I don't know. I mean, one place to look, there's a pretty good description on the Cleveland Clinic website. They have a pretty good description of Charles Bonnet syndrome. The other resource that is a good resource for all kinds of eye conditions is the American Academy of Ophthalmology. They have a pretty good description of any of these. They'll have one of Stargardt's, of retinitis pigmentosa, but also of Charles Bonnet syndrome. So if you type that, even if you just type it into Google, I think one of the first two results is the American Academy of Ophthalmology, which is a good, reliable source for these things. And then the Cleveland Clinic one comes up very soon after that. So those are two really good resources that have things that you should think about, things you might worry about if you're concerned that you might have this. So that's where I would turn people maybe first.
Dan, will you include those in that resource list
Sure.
you send out?
Yes, Dr. Young, can you remind me of those, and I'll make sure I write those down.
So
I got two or three of them.
Yeah. The last thing is sort of procedural. Someone was asking about credit. Was there an opening code and closing code? How do people get CEUs?
For the teachers that are on the call tonight, there is ACVREP credit. The opening code was peanut butter. I put it into the chat. I forgot to say it out loud, but peanut butter is the opening close code, and the closing code will be jelly. So
okay, that's memorable.
Peanut butter and jelly, yeah.
Yeah,
And
with a
that's-
one, yes.
That's it for comments.
All right. Well, I want to thank Dr. Young and our panelists. Thank you so much for giving your time and sharing your information and your experiences. I think this was a great discussion, and I'll be sure to collect the resources we talked about and include those in the email that we send out. For those of you who are getting credit, you do need to send me the survey with the opening and closing codes attached to it. give me like a week because I'm doing this all by myself to get you guys your certificates back with the credit. I will get them to you. Just give me a week. So
Will you send the survey, Dan, or has that already been sent out?
it was with the link to
Oh, okay.
join. Yeah,
Okay, great, great. Thank you.
And if you, for whatever reason, don't have it, send me an email and I'll send it to you.
That's fine. I would like to thank Lois and Kathy and Dr. Young. This has been really excellent. And I just want to just not put that in the chat, but thank you for taking the time to do this. This is Audrey.
Thank you, Audrey.
Yes, and I want to thank Dr. Young for expressing his whatever the Charles Bonnet syndrome was, and I'd like to read up some more. And thank you, Lois, for sharing your experience.
It's been a privilege. Thank you, everyone. And we do need to educate people.
Yeah, and along those lines, I really appreciate being on this panel today, because I think I've realized a little bit more that maybe I should be doing a little more to educate my patients. Certainly, I appreciate Lois's example, but also I hope to be able to help with other medical providers. I know that I certainly can have opportunities to talk with other medical providers about this, and I think I'll be more motivated to do that. So I really appreciate being able to be part of this.
Thank you, Dr. Young. All right. Well, thank you all, and we'll be in touch. We'll get this uploaded to YouTube probably early next week, and we'll send out the recording along with the resources. So thank you all for being here. Really appreciate it.
Thank you.
And take care.
Have a good weekend, everyone.
Take care, everybody.